15 signs of brain cancer. Have you ever wondered how the brain, this complex and fascinating organ, can give signs that something is not right? Could symptoms, such as frequent headaches or memory difficulties, hide something more serious? What if there are silent alerts that you don't notice, but that are indicating serious problems? Our brain is the body's control center, but it is also vulnerable. When something is wrong, it tries to communicate through signals that we often ignore. That's why knowing these signs can be the difference between an early diagnosis and irreversible complications. In this content, you will discover the 15 most important signals that your brain may be sending to ask for help. Pay attention to every detail because your health may depend on it. Let's get started. 1. The headache that won't go away and can be a serious warning. Headaches are common and most of the time harmless. But what to do when they become persistent, intense, and deviate from the usual pattern? This type of pain can be one of the brain's first warning signs. Brain cancer, especially when growing, can increase intracranial pressure. This increase in pressure causes headaches that do not improve with common painkillers and can worsen over time. They tend to be more intense in the morning or when the person changes position abruptly, such as when getting up or bending down. Furthermore, the pain may be accompanied by other symptoms, such as nausea and vomiting. Therefore, it is essential to pay attention to the frequency, duration, and intensity of headaches. If they deviate from the normal pattern and are accompanied by other signs, it is essential to seek out a healthcare professional. Only specific tests, such as CT scans or MRIs, can identify what is causing the problem. Ignoring these symptoms can delay a crucial diagnosis, compromising the chances of successful treatment. Therefore, never underestimate a persistent headache. It may be one of your brain's first cries for help. 2. Sickness and vomiting that seem to have no explanation. But do they? Feeling sick or vomiting is something that many people associate with stomach problems, but the cause is not always there. When these symptoms appear for no apparent reason and are not linked to food, they may be a warning sign from the brain. In the case of brain cancer, increased intracranial pressure can affect areas responsible for controlling balance and coordination of the nervous system, causing frequent nausea and vomiting. What differentiates these symptoms from the more common ones is that they generally do not improve with motion sickness medication. Furthermore, they can be more intense in the morning or after sudden movements, such as getting up quickly or changing the position of the head. Another important point is to observe whether vomiting occurs without any other gastric symptoms, such as abdominal pain. When these signs appear in conjunction with other neurological symptoms, such as headaches, blurred vision, or weakness, the risk that they are related to brain problems increases. Ignoring this type of symptom can lead to delays in diagnosis, reducing the chances of early and effective treatment. Therefore, if you or someone close to you is experiencing persistent nausea or vomiting with no apparent explanation, it is essential to seek medical advice. The body sends signals, and it is up to us to pay attention to act in time. 3. Blurry or double vision, when the problem may be more serious. Vision problems are often attributed to tiredness, age, or refractive errors such as myopia or astigmatism. But what happens when blurry or double vision appears suddenly, persistently, or without a clear reason? Visual changes can be one of the first signs of brain cancer, especially when there is pressure on optic nerves or specific regions of the brain responsible for vision. Blurred or double vision may occur intermittently at first, but tends to worsen over time if the cause is not treated. Additionally, some people report blind spots or difficulty focusing, which can hinder simple activities such as driving or reading. Another related symptom is sensitivity to light, which may be accompanied by eye pain. These changes may occur alone or in conjunction with other signs such as headaches or nausea. It is worth remembering that blurred vision is not just a nuisance, but an indication that something is wrong in the nervous system. Therefore, any persistent or progressive change in vision should be investigated carefully. Ophthalmological exams can help, but in suspected cases, Neurological exams, such as tomography or magnetic resonance imaging, are necessary to rule out or confirm changes in the brain. Never underestimate a visual symptom, even if it seems temporary. Your brain may be trying to tell you that something isn't right, and acting early can make all the difference. 4. The tinnitus or hearing loss. You should never ignore. Hearing loss and ringing in the ears are often associated with aging, exposure to noise, or infections. However, when these symptoms appear suddenly or persistently, they may indicate something more serious, such as a brain tumor. Brain cancer can affect the auditory nerves or regions near the brainstem that control hearing. This interference can cause persistent ringing in one or both ears, a sensation that is often described as a high-pitched or pulsing sound. Hearing loss can occur gradually, making it difficult for the person to notice that they are hearing less over time. Another alarming aspect is the sensation of pressure or pain in the ears, which may appear without an apparent explanation. These symptoms can be worsened by changes in balance, such as dizziness or vertigo, which are controlled by the same brain structures responsible for hearing. Although not all tinnitus or hearing loss is related to cancer, it is essential to be aware of these signs, especially if they are accompanied by other neurological symptoms such as headaches or difficulty speaking. Consultation with an otolaryngologist is the first step, but in suspected cases more in-depth examinations, such as MRIs, may be necessary to evaluate the brain. Remember that hearing is one of the channels through which the brain can give signals that something is wrong. Don't ignore what your body is trying to communicate. 5. Forgetting things or feeling confused. A brain warning signal? Forgetting where you left your keys or losing the thread of a conversation from time to time is common. But when memory lapses and brain fog start to interfere with daily activities, it can be an important warning sign. Brain cancer, depending on its location, can affect areas responsible for memory and cognition. This can lead to frequent forgetfulness, difficulty remembering recent events, or processing simple information. Furthermore, it is common for people to feel general confusion, as if they are constantly off or disoriented. Another worrying aspect is when these difficulties appear suddenly or progressively worsen. Simple tasks like remembering someone's name or organizing ideas can become a challenge. This symptom is often underestimated or attributed to stress, lack of sleep, or even aging. However, when combined with other neurological signs, such as persistent headaches, mood changes, or coordination problems, it may indicate something more serious. Performing cognitive tests and imaging tests can help identify the cause of these changes. Diagnosing the problem early can not only protect your memory, but also save your life. If you notice that you frequently forget information or feel constantly confused, don't hesitate to seek medical help. Your brain may be crying out for help. 6. Words that disappear. When speech doesn't go as expected. Have you ever had difficulty finding a word that is on the tip of your tongue? While this is normal from time to time, persistent speech problems can be a worrying symptom. Brain cancer can affect specific areas responsible for language, such as the frontal lobe or temporal lobe. This can manifest itself in a variety of ways, from difficulty finding words to more serious problems, such as the inability to form complete sentences. Some people start to exchange words for ones that don't make sense, while others simply can't organize their ideas to express themselves. Additionally, there may be difficulty understanding what other people are saying, making simple conversations a challenge. These symptoms may appear gradually, but in some cases they appear suddenly and intensely. It is important to observe whether these problems are accompanied by other signs, such as mental confusion, headaches, or motor changes. Speech difficulties are not just inconvenient, but an indication that the brain is experiencing some type of dysfunction. If you or someone close to you is experiencing these symptoms, seek medical advice immediately. Neurological and imaging exams can identify the cause of the problem, enabling appropriate treatment. 7. Weakness or paralysis. What is your body trying to tell you? Experiencing sudden weakness in an arm or leg can be a symptom that many associate with a stroke, but it can also be related to brain cancer. Tumors located in specific areas of the brain can affect motor control, resulting in muscle weakness or even partial paralysis. This weakness may manifest itself subtly at first, such as difficulty holding objects, stumbling frequently, or dragging one foot when walking. Over time, movement may become more limited, and the person may completely lose the ability to use one of their limbs. In some cases, weakness may be accompanied by numbness or tingling, which indicates that nerves are also being compromised. Another important feature is that these symptoms usually occur on just one side of the body, depending on where the tumor is located in the brain. If you notice these signs, it is essential to seek medical help as soon as possible. In addition to physical exams, imaging tests such as CT or MRI are essential to determine the cause. Weakness or paralysis should never be ignored, especially when they appear suddenly or progressively. 8. Losing balance. What does lack of coordination mean? Have you ever had difficulty balancing yourself when walking or performing simple activities, such as picking up a moving object? Loss of balance and lack of motor coordination are signals that the brain may be sending when something is wrong. Tumors located in the cerebellum, the region of the brain responsible for motor control and balance, can impair the ability to perform precise movements. This difficulty can arise in subtle ways, such as tripping more frequently, dropping objects, or feeling insecure when going up and down stairs. As the problem progresses, routine activities such as walking straight or standing without support can become challenging. These symptoms are often accompanied by dizziness or a feeling of lightheadedness, which makes it even more difficult to maintain balance. Changes in coordination should not be ignored, especially if they are persistent or appear progressively. When combined with other signs, such as muscle weakness, vision problems, or mental confusion, they indicate the need for immediate medical evaluation. Detailed neurological exams and brain imaging, such as MRIs, are key to identifying the cause of these symptoms. If your balance is compromised, your body is sending you an important warning. Ignoring these signs could mean delaying a crucial diagnosis. Pay attention to what your body is trying to communicate and seek help without delay. 9. Unexplained seizures that may hide something more serious. A seizure is a frightening event, both for those experiencing it and those who witness it. It occurs when there is abnormal electrical activity in the brain, resulting in involuntary movements, loss of consciousness, or sensory changes. Although there are several causes for seizures, such as epilepsy or head trauma, they can also be one of the first signs of brain cancer. Tumors can irritate brain tissue, triggering seizures even in people who have never had this type of problem before. They can range from mild episodes, such as involuntary movements in a single part of the body, to generalized seizures that affect the entire body. Another important aspect is that tumor-related seizures often do not have a fixed pattern and can occur at any time, without warning. Even if the person regains consciousness after the event, the brain has already given a clear signal that something is wrong. If a seizure occurs without an apparent explanation, such as a high fever or medication withdrawal, it is essential to investigate immediately. In addition to neurological exams, an MRI or CT scan can help identify the presence of abnormalities in the brain. Seizures should not be ignored or treated as isolated episodes. They are a cry for attention from the brain and require urgent medical follow-up to discover the cause and ensure appropriate treatment. The sooner you act, the greater the chance of protecting your health and preventing complications. 10. Unstable mood or depression. Could it be the brain showing signs of problems? Mood changes are common and can occur for a variety of reasons, such as stress, tiredness, or difficult emotional situations. But what happens when these changes become frequent, intense, or outside the usual pattern? Brain cancer, depending on its location, can affect areas that control emotions and behavior, such as the frontal lobe and limbic system. This can result in sudden changes in mood, such as going from extreme irritability to apathy in a matter of hours. Depression can also be an important sign. People who have never had a history of depression may begin to feel deep sadness, discouragement, or lack of interest in activities that were previously enjoyable. These symptoms are often accompanied by difficulty concentrating, changes in sleep and appetite, or even confused thoughts. Furthermore, some people exhibit impulsive or inappropriate behavior, which can cause strangeness among friends and family. The challenge here is that these emotional symptoms are often confused with isolated psychological problems, delaying diagnosis of a possible neurological cause. Therefore, when mood changes or depression appear along with other symptoms, such as persistent headaches, weakness, or speech problems, it is essential to seek medical help. Only a professional can determine whether these signs are related to brain changes. Don't underestimate the impact these emotional changes can have. They may be the brain's way of saying it needs attention. 11. Extreme tiredness or unusual drowsiness. A silent warning. Feeling tired at the end of a long day is natural, but what happens when the tiredness is constant and there seems to be no explanation? Extreme tiredness or excessive sleepiness could be symptoms that the body is fighting something more serious, such as a brain tumor. Tumors can interfere with blood circulation and intracranial pressure, affecting the brain's ability to function normally. This makes a person feel exhausted, even after a good night's sleep. Furthermore, it is common for simple activities, such as walking short distances or carrying out household tasks, to require enormous effort. Excessive drowsiness is also a warning sign. It may indicate that the brain is overloaded or that there are changes in the biological rhythms controlled by it. These symptoms can be accompanied by difficulty concentrating, lack of motivation, and even momentary lapses in memory. Extreme tiredness is often attributed to problems such as anemia, stress, or lack of vitamins, which can delay a more serious diagnosis. However, when this symptom appears persistently and without an apparent explanation, especially alongside other neurological signs, it is essential to see a doctor. Clinical and neurological exams are essential to find out what is causing this unusual fatigue. Pay attention to how your body reacts to tiredness. If it is disproportionate to the effort made, it could be a warning that something is wrong with your brain. 12. Altered sensitivity. When dummy is a serious sign. Have you ever felt parts of your body numb or tingling for no apparent reason? Although these symptoms are often attributed to circulatory or postural problems, they can also be a warning sign of something more serious, such as brain cancer. When a tumor puts pressure on or interferes with the nerves or brain regions responsible for sensitivity, it can cause changes in how the body perceives touch, temperature, or even pain. Numbness may begin subtly, affecting just one specific part of the body, such as a hand, arm, or side of the face. Over time, these symptoms can spread or become more intense, making simple tasks such as holding objects or typing difficult. Additionally, persistent tingling, or the feeling that certain parts of the body are numb, may be an indication that signals between the brain and the rest of the body are being disrupted. When altered sensitivity is accompanied by other symptoms, such as muscle weakness, difficulty speaking, or coordination problems, the situation becomes even more worrying. These signs should not be ignored, as they may indicate the presence of a tumor interfering with the normal functioning of the nervous system. If you or someone close to you is experiencing persistent numbness or unexplained tingling, seek medical evaluation immediately. Neurological and imaging exams are essential to identify the cause and take timely action. Paying attention to these small signs can be the difference between early intervention and serious complications. 13. Difficulty chewing or swallowing. Is something wrong? Eating is an activity we do automatically, but what about when chewing or swallowing becomes a challenge? Changes in swallowing can be a sign that something is affecting the brain, particularly the areas that control the muscles involved in this process. Tumors located in the brainstem or motor areas can interfere with the coordination needed to chew and swallow. This can manifest as frequent choking, difficulty moving food through the mouth, or a feeling that food is stuck in the throat. In more serious cases, the person may begin to avoid certain foods or liquids, fearing discomfort or constant choking. Another common symptom is changes in speech, as the same muscles used for swallowing are essential for articulating words. These signs, often attributed to problems with the throat or digestive system, may indicate a more serious neurological cause. When these difficulties arise suddenly or worsen over time, it is essential to see a doctor. In addition to clinical exams, brain imaging tests can help identify whether there is a tumor interfering with these processes. Choking occasionally may not be a concern, but when it becomes frequent and interferes with eating, the body is asking for attention. Remember that symptoms like these are important red flags and deserve careful investigation to ensure your health and well-being. 14. Bowel or urinary habits that change from nowhere. Changes in bowel or urinary habits are often associated with gastrointestinal problems, infections, or aging. However, when these changes occur suddenly and without an apparent cause, they could be a sign of something more serious, such as brain cancer. The brain controls many aspects of bodily functions, including the excretory and urinary systems. Tumors located in the brain stem or in specific areas of the central nervous system can interfere with these automatic processes. This can result in urinary incontinence, difficulty urinating or having a bowel movement, or even loss of complete control over these functions. Another worrying sign is severe constipation, or a sudden increase in the frequency of bowel movements without changes in diet or lifestyle. These symptoms may be accompanied by other neurological signs, such as weakness, numbness, or loss of motor coordination, suggesting that the root of the problem is in the brain. These changes are often attributed to less serious conditions, delaying the diagnosis of something more serious. Therefore, it is important to observe whether these symptoms persist or worsen over time. If combined with other signs, such as headaches, dizziness, or mental confusion, seeking medical help becomes essential. Through neurological and imaging exams, it is possible to identify the exact cause and initiate appropriate treatment. Don't ignore changes in basic body functions. They may be the brain's way of alerting you to something that needs urgent attention. 15. The symptom that no treatment resolves. What could this mean? Sometimes you may notice a persistent symptom that does not improve, even with conventional treatments. It could be a headache, constant tingling, nausea, or vision changes that just won't go away. When the usual treatments are not effective, it is a strong indication that the origin of the problem may be something deeper, such as a brain tumor. These symptoms can be particularly challenging because they are often treated in isolation, as if they were independent problems. For example, headaches can be confused with migraines, and changes in vision can be attributed to tiredness or age. However, the persistence of these signs, especially when combined with other neurological symptoms, such as difficulty speaking or loss of balance, requires immediate investigation. Brain cancer can resist conventional treatments because the underlying cause lies in the brain tissue itself, not in the directly affected systems. Therefore, when a symptom seems stubborn and does not respond to medications or therapies, it is time to seek a deeper analysis. Exams such as computed tomography or magnetic resonance imaging are fundamental tools to find out what is happening. Do not wait for symptoms to worsen before taking action. The body has ways of letting you know it needs help, and it's up to you to listen to these signals. Identifying and treating the cause as early as possible can make all the difference in preserving your health. Our body is an extraordinary machine, and the brain, as its central command, never stops sending us signals. Ignoring these warnings can be costly, but listening to what your body has to say could be the first step to saving your life. Each of the 15 signs mentioned here is a chance to act before it's too late. Early detection of brain problems not only increases the chances of successful treatment, it also protects your quality of life. If you have recognized any of these symptoms in yourself or someone close to you, don't hesitate. Seeking medical advice may seem like a small step, but it can lead to big results. Remember that your health is the most valuable asset you have. Take care of her with attention, affection, and responsibility. You are not alone on this journey. Listen to what your body is trying to tell you and never underestimate the power of taking action at the right time. Your life and your future are in your hands.